PNC, America's Black News Channel. Watch us on all major cable providers and major streaming platforms. Finally, news that speaks to us.
According to the Guttmacher Institute, just last year, U.S. states passed at least 108 abortion restrictions, making it the single worst year for reproductive health care access in the country's history. One of the most restrictive is Texas, SB 8, which not only bans abortion after 6 weeks, but also deputizes citizens to file civil action against providers. And despite already enacting one of the strictest abortion bans in the United States, Tennessee Republicans are advancing their own Texas-style amendment, strategically written to sidestep legal challenges. Joining me now is Dr. Nikia Grayson, a certified nurse and midwife and director of clinical services at Choices, a Memphis clinic for reproductive health care. Welcome to Amplified. Nikia, first of all, Tennessee already has a heartbeat law that bans abortion at around the 6-week mark, but legal challenges filed by providers have stopped it from being enacted. What has been the reaction in the provider community to this new proposal, which would essentially create bounty hunters out of citizens who could bring civil action against you?
Yes. Well, thanks for having me. Providers are truly worried about this. They are seeing the state sanction, harassment and surveillance of pregnant people, and that this is really a violation of pregnant people's civil rights, right? And so what we are seeing is, as these bills continue to come up and be further advanced through our legislation, that it will continue to penalize pregnant people for their pregnancy outcomes, whether they have a miscarriage or any other type of loss. And so we're really worried about this because it is going to be extremely harmful to all the families in our communities.
And unnecessary, but this new legislation would ban almost all abortions in the state, including in cases of rape and incest. The rapists wouldn't be able to sue, but their relatives could bring a civil action? All this sounds crazy to me. Talk about the ramifications of something like this.
I mean, this bill is extremely harmful. We know that abolishing abortion rights in Tennessee will place serious detriment on pregnant people and the options they have, in regards to their pregnancy and their bodies. They will lose complete bodily autonomy. And that, of course, we know that these type of legislative bills really further hurt underserved communities, right? We looking at how they will hurt Black and brown communities, young people, low-income communities, and those in rural areas. And this is just going to be extremely harmful. This makes it that patients aren't capable of making their own medical decisions, without undue delays from the state. And so many people are working on fighting against this, but many people are very worried about what will happen, even with what's happening in the Supreme Court now.
Tennessee lawmakers have also advanced legislation banning mail delivery of abortion medication, which could terminate early-term pregnancies up to 10 weeks. Now, for many, the only option is to actually leave the state. So I want you to say a little bit more about how this move and all the moves could impact women who are in economically disadvantaged communities, which, to your point, it tends to be people of color. But put a fine point on that for us, because there's clearly a target community that they're going after.
Absolutely. I mean, abortion access to people with means has always been there, right? So what we're seeing now is, with this Texas ban, we're already seeing many people coming across the state lines to access abortion care, which is making it even a longer wait for those who are in the state of Tennessee to access care in the few clinics that are local to them. So what is happening is that people are having to travel across state lines and travel long distances to access basic care. And what we're seeing here in Tennessee is that the clinics are becoming super crowded, and we're at capacity. And so this is really scary, because there are many people who need abortion care, not just who have decided that they're not ready to be parents, but also those who have medical issues that deem it necessary for them to have a termination.
This type of legislation is being proposed in states around the country, particularly in the Southeast, where pretty soon there actually won't be a state where women can receive safe, legal abortions. You can't drive to the next one or to the next one because this is like all happening and being boxed in regionally. You got places like Missouri that are working to penalize women who actually go out of state for the procedure. Yeah. So could you speak to the long-term effects for reproductive rights if anti-choice advocates are actually able to implement this strategy?
Yes, these bills and these strategies will have long-term consequences. Like I said, many of those who don't have access usually are those communities that are underserved and those who are in rural areas. And what we're seeing is that many of these families will be left with no options. They're already medical deserts in Tennessee that have no access to basic prenatal care and basic medical services. So these families are already having to travel long distance just for basic medical care and medical services. So this is going to make it extremely hard. We know that the South and probably around 25 states will lose access to abortion. And what we'll see is those states who have safe haven laws, like Illinois or California, will become overcrowded in those states, and where people will really be in need of care. But it will make it even harder for them to transport to other spaces because they don't have the resources. They don't. Presently here in Tennessee, there is a 48-hour waiting period to access abortion care, meaning you have to come to the clinic one day and then you have to come back 48 hours later. We're already finding that this is a great barrier for many of our patients because they have to take off work for 2 days. They have to find childcare for 2 days. They lose wages for 2 days. And so these laws and these barriers will only make it even harder for people. And what we are fearing is that we will start to see people having pregnancy or trying to terminate their own pregnancies without proper medical care. Abortion is extremely safe. Medical abortion is extremely safe. And so we're being pushed back into a time where people will have to do things out of desperation.
And we know what that looks like because we've been there before, and so many women, you know, were harmed out of the need for the desperate acts there. Now, we know that the ultimate goal here is to overturn Roe versus Wade. As you mentioned, half the states in this country may end up enacting some kind of crazy ban because it seems like conservatives are emboldened given the makeup of the current Supreme Court. And we're having this conversation with the backdrop now of a nomination process underway for the first black woman to be appointed to that court. What, you know, can be done right now at the local level to counter these attacks on reproductive rights, given that the court may not be, you know, in a good place yet, and it seems like the only path is through the federal court? But what's the block and tackle strategy?
Yeah, so we are working on strategies. I think that we have seen this coming down, you know, the pike. So we knew what was going to happen. There are many local advocacy groups here in Tennessee, like Sister Reach, like Healthy and Free Tennessee, Planned Parenthood, as well as our organization Choices, that are working to oppose these bills, right? There are many reproductive health providers. We are working diligently to fight against these unjust bills and advocate for our communities. We are also working across state lines with other advocacy groups, abortion funds, and other clinics and practitioners to ensure that people have access to the care they deserve. And so what we're finding is that we are really creating this network of clinics and abortion funds and abortion advocates to help people move from space to space to get the care that they need and deserve.
That network is going to really be, you know, the foundation and net worth of this entire movement. There's so much fighting ahead and blocking and tackling that needs to happen. Dr. Nikia Grayson, Director of Clinical Services at Choices in Memphis, Tennessee, thank you so much for joining us on Amplified. We'll keep watching the situation there on the ground.